Hey, David here. Have you ever felt of fear, unreasonable worries, or scared of something that doesn't even exist? You might be having anxiety disorders. Okay, hold up. So, what exactly is anxiety disorder? According to Wikipedia, anxiety disorders are a cluster of mental disorders characterized by significant and uncontrollable feelings of anxiety and fear. Okay, to be put on easy explanation, anxiety is a worry about future events, while the fear is the reaction of the current event. People with anxiety disorders are just worries on everything at any time. How could I know that people are having anxiety disorders? There are several symptoms, physically and cognitive, such as restlessness, difficulty on concentration, increased heart rate, chest pain, and many others. Are anxiety disorders dangerous? Anxiety disorders can cause rapid heart rate, palpitation, and chest pain. You may also be at increased risk of high blood pressure and heart disease. And if you already have heart disease, anxiety disorders may raise the risk of the coronary events. By knowing that this mental illness could be harmful, it absolutely needs medication. By pharmacy field point of view, there is a kind of medicine and medication could be given to people with anxiety disorders. These people need anxiolytic. So, what exactly is anxiolytic? Anxiolytic or anti-anxiety drugs are a group of drugs that can prevent or treat symptoms of anxiety, especially in patients with generalized anxiety disorder. This medication may also be prescribed for other mental conditions such as social phobia, as well as used as a sedative for anesthesia in medical procedures. To treat anxiety disorders, doctors often combine anxiolytics with therapies such as psychotherapy and cognitive behavioral therapy. However, doctors will give anxiolytics only for short-term consumption, considering this drug can be addictive to the patient. Patients with a history of drug abuse are usually not given anxiolytics. In addition to anxiety disorders, social phobia, and being sedatives, some anxiolytics may also be prescribed by doctors for other conditions, including depression, insomnia, seizures, vomiting, nausea, and panic disorders. There are also several kinds of anxiolytic drugs a doctor could prescribe. They are the benzodiazepine group of drugs, buspirone, prazolam, and hydroxyzine. Usage of these drugs may cause side effects on patient's body, so make sure you or your relatives are at home or another safe place before consuming these drugs. Anxiolytic may cause certain side effects such as drowsiness, confusion, drug addiction, nausea, diarrhea, headache, suicidal thoughts, high blood pressure, and heart rate increase. Anxiolytic as anti-anxiety are potent drugs, and doctors' directions are absolutely needed in consuming in this medication process. The reason is this drug has the following usage warning. And the first one is addiction. Some types of anxiolytics can be addictive. Patients are at risk of experiencing dependence of anti-anxiety drugs, especially if they are consumed in the long term. Long-term use of anxiolytics can also trigger drug tolerance. This means that the patient will need more of the drug to get the same effect. The second one is withdrawal symptoms. You should consult your doctor before stopping taking anxiolytics. Suddenly stopping, no, that's a bad idea. So, suddenly stopping taking anxiolytics can trigger withdrawal symptoms, including seizures. The doctor can provide a strategy for stopping drug consumption safely and slowly. And the last one is overdose. Take the drug according to the dosage given by the doctor. Anxiolytic drug overdose can risk leading to the coma or even death. So make sure to consult with your doctor or psychiatrist if you feel you have this condition. Better prevent than curing, right? Stay safe and see you around.